So this is NCLEX Prep over Pediatrics. My name is China Williams. I am a BSN RN, and this is just a short snippet over pediatrics. So before you get started with studying for the NCLEX, it is kind of helpful to go over the categories on the test just to familiarize yourself with what you will see throughout the test and how the questions will ask you over certain topic groups. Um, Even though we study nursing divided up with like med surg, pediatrics, mental health, when you test on an NCLEX, even though you will see those individual areas, it will be broken up into the categories. So these are the 4 different types of categories that are tested on an NCLEX and a percentage for each. If you will notice that management of care is a big portion of the NCLEX-RN. I provided this link. It's a link to a quiz that shows you what type of learner you are. I know when I was in nursing school, doing activities like this showed me what type of learner I was. Rather, some people might be auditory or visual, but it helped me so I could come up with a study plan for my test and also learn how I retain information. So if you can, go ahead and click that link and take the quiz and view your results. The nursing process. This is a tool that we use throughout nursing school and in our nursing careers, but a lot of times we don't realize how helpful it is to us, especially with the NCLEX. Honestly, the nursing process, I think, is one of the keys to help you break down these test questions. So when I was in LPN school, we used ACI, but when I was in RN school, we used Kaplan. And Kaplan has this thing called the decision tree. If you have already been through their it's like this little thing that they do at the end of your nursing program, and it's like a comprehensive review for the NCLEX. So when I did that in the RN program and we went over the decision tree, for the life of me, I could not grasp the concept at the time of how useful it was. So it did not click to me what the decision tree was until I had watched this YouTube video, and I feel like that's what helped me to break down the NCLEX questions. Okay, so this is just tips for pediatrics, but this is not like a full-on review for pediatrics, but I just want you guys to not only utilize this for pediatrics, but also kind of take some of the tips and apply it to med surg, mental health, mother, baby, like any area that you struggle with. And then also make sure you get you like a good comprehensive review book. The comprehensive review book that I used on my second attempt for the RN NCLEX was the 19th edition comprehensive NCLEX-RN review, and it's by ATI. It's like pink and white. So when you're going over pediatrics, some of the highlight areas you just want to hit are like the vital signs and milestones. Make sure you kind of review the cognitive development and the psychosocial development. And then when you're going over home safety preventative measures, this could be something that like you could teach to parents or caregivers of their children, like keeping things out of reach, and that's stuff like, bleach, medications. If you're cooking, you might want to cook on a back burner instead of the front burner so the child doesn't reach and touch the hot surface and get burned. Also, you might want to look into, accidents like car accidents, uh, safety, especially like when they're in a hospital setting or something similar. You want to make sure that you kind of keep equipment out of the reach of a child. Because say for instance, if you're like putting like an IV pole like right next to their crib, they can, stick their hand through the crib and like grab the IV pole and knock it over. So kind of just like think about stuff like that. That would be probably like a fundamental safety type question, I would think, on the NCLEX. Um, and then you want to make sure you like teach on procedures and surgery. But when you're teaching on that stuff, make sure you kind of keep in mind of each age group. Because, like something that you would teach a toddler, you wouldn't teach it to an adolescent. And then also kind of just review kind of like common childhood diseases, their vaccination schedule, and stuff like that. So we are going to talk about gentamicin. Gentamicin, of course, is an antibiotics. Some of the reasons why you might use gentamicin is for sepsis, meningitis, pneumonia. When you are using gentamicin, as a nurse, you would want to look for, if they report any ear or kidney problems. And then you will want to monitor certain labs like their creatinine, their BUN, and then also monitor their trough levels. And some nursing interventions and education might be, you would want to know if they're allergic to any medication, because sometimes if they might be allergic to something in the same class, that might be some information you will want to know so you can let the doctor or the pharmacist know. If they have a recurrent infection, you want to know what was their prior treatment to them being put on the antibiotics that they're currently on. You want to monitor for signs and symptoms of a reaction from the medication. You want to also make sure you assess for secondary infection, and then you want to make sure you are giving them medication at the appropriate time intervals. And before you perform the medication therapy, you want to make sure you have already performed the CNS, which is the culture and sensitivity test. And then always, 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 you want to make sure that you educate the patient on completing the medication regimen, whether that be the patient or the caregiver. Okay, so this is just briefly nursing care in a hospital or a similar setting for pediatrics. So one of the things you kind of want to look out for as a nurse is the stages of separation anxiety. So you might see like a toddler. You might see them like screaming. If they're in a protest stage, they might be screaming or physical aggression. If they in the despair stage, you might notice like withdrawal or developmental regression. And then if they're in the detachment stage, you might notice they start to interact with strangers and appear happy. So what are some interventions you could do as a nurse? You could encourage the family to stay with the child. When you are doing nursing assignments, if you have a pretty consistent staff, you might want to try to keep the child with the same caregivers. And then you want to allow the child to make decisions. Like say for instance, If you bring the child like a toy car and say we're talking about toddler or 2-year-old, and you say, do you want the red car or the green car? Like something as simple as that. And then also you want to use like stuffed animals or toys to explain procedures or treatments to a toddler. We'll just say in this whole scenario, we're talking about a toddler or a 2-year-old child. And then as a nurse, you want to recognize the stress that a child could be experiencing and intervene. And then make sure you provide appropriate toys for age and development. A child with cystic fibrosis is receiving gentamicin. Which nursing action is most appropriate? A. Monitoring intake and output. B. Obtaining daily weights. C. Monitoring the client for indications of constipation. D. Obtaining stool samples for hemoccult testing. So when I go back and read my questions, some of the things that really stands out, the most important topic would be gentamicin, because we need to know what medication are we giving this patient. And then also maybe cystic fibrosis. So when I look at A, I do think that I would keep it because it does sound pretty important, huh? Now, when I come down and look at B, the first thing that pops up in my head is like CHF, fluid retention, cardiac. And I know that cystic fibrosis and gentamicin really don't fall in that category. So I would go ahead and mark B out. And then C, monitoring the client for indications of constipation. Normally, when you are giving an antibiotic, it will probably cause diarrhea rather than constipation. So I would go ahead and mark out C. And then D, obtaining stool samples. Mainly if you were to obtain a stool sample while a patient is taking antibiotics, it would probably be for C. diff and not for hemoccult testing. So I would mark out D because it's just not matching up. So now all I have left is A, and that is monitoring the intake and output, which we did already review gentamicin, and that is one of the things because you don't want the kidneys to shut down, and you will also monitor the creatinine and BUN as well. A 2-year-old child is hospitalized for a fractured femur. During his first 2 days in the hospital, he lies quietly, sucks his thumb, and does not cry. Which is the best interpretation of his behaviors? A. He has made a good adjustment in the hospital. B. He is comfortable with the nurses caring for him. C. He is experiencing anxiety. D. He does not have a good relationship with his parents. Okay, so when we look at this question, we would look and see what are some of the keywords, which the 2-year-old child gives me an idea of what stage and age group this child is in. And then it's talking about we want to know what his behaviors mean. And when we look at his behaviors, it says he lies quietly, sucks his thumb, and does not cry. So now when I go back to my choices, and I see what all we have. I know that this question, it has nothing to do with his relationship with his parents, so I would go ahead and mark out D. And then another one is he has made a good adjustment in the hospital. I know this is not true after reviewing the stages of separation anxiety, because if he would have made a good adjustment, we would be seeing things that fall under detachment, which is interaction with strangers, and appears happy. His behaviors does not suggest that he appears happy. Okay. And then if I didn't know what the stages were, I would probably pick B. But B and A kind of go together, because if he would have made a good adjustment in a hospital, then he would feel comfortable with the nurses caring for him. So we will also cross out B. So with our answer, we are left with C. He is experiencing anxiety. So I included this video because this is literally what helped me to break down NCLEX style questions. So when I went back to go take my second attempt for my NCLEX, I passed. But this really showed me how to break down the questions, to critically think and answer them. And so I hope that this PowerPoint will be helpful to you, and I hope that all of the activities and videos that I included would be helpful as well. Thank you. And if you have any questions or any suggestions, just leave them down in the comment box if you want me to go over other things or different topics or other tips and tricks, or study tips and schedules.